Dear friends and colleagues, greetings to you all on the occasion of this very first International Congress on Logotherapy and Existential Analysis in Ukraine. Many thanks to the organizers and especially to Mrs. Natalia Khmelova for her kind invitation. A few months ago, I offered a presentation on supervision and consultation in logotherapy and existential analysis, and I was asked to summarize this presentation for you today. In a nutshell, we spoke about the relevance, the characteristics, the similarities and differences between supervision and consultation within the framework of logotherapy and existential analysis. We described the stages of therapist development, the topics that we usually cover in logotherapy supervision, and the specific competences that we aim to develop. Clinical supervision follows theoretical education in the principles and method of logotherapy and existential analysis, ensuring that practitioners possess the understanding and the skills that they require to apply those principles in their clinical work. Although clinical supervision in logotherapy was historically informal and it relied on observation in clinical settings, it is currently a structured and thorough formal agreement. An expert senior therapist and a student or a less experienced therapist agree on a supervisory contract and a framework to guide their meetings. Through these regular meetings, the supervisee is systematically guided to develop their skills. Clinical supervision involves scaffolding. Scaffolding is a term borrowed from developmental psychology, and it's a term that means building upon a practitioner's pre-existing skills. Evaluation and feedback are used to substantiate progress in line with the ethical standards that guide professional psychotherapy. A specific feature of supervision is that the senior therapist holds authority and assumes ultimate responsibility for the well-being of the clients. Therefore, the relationship is highly regulated and it is guided by the agreed upon contract. Clinical consultation, by contrast, is a process where there is usually no written contract, and the responsibility of the well-being of the client is that of the treating therapist. So it's not that of the supervisor, but it remains with the treating therapist. The consultant acts as a peer to increase the competencies of the therapist by discussing a specific clinical dilemma. As much as the formal definitions of supervision and consultation describe two different processes, which was the focus of my previous presentation, there is a commonality between supervision and consultation, and this commonality lies in the quality of the relationship between professionals, a quality that is quite pronounced in logotherapy and which I would like to focus on today. Logotherapists share a genuine interest in the well-being of their clients that surpasses standard job descriptions or the mere satisfaction of ethical obligations. We aim to provide information that is personally and professionally relevant. This means that logotherapy is not just an imparting of knowledge, but a genuine care that the information provided is pertinent to the other. The aim is to be of benefit to the other, to be useful to the other, and to seek what is true, good, and beautiful. In other words, to seek what is meaningful and to seek it together. I want to share a brief illustration. When I was a young therapist, and this was now 25 years ago, I visited Dr. Elizabeth Lucas in Fürstenfeldbruck, Germany. I was preoccupied with wanting to apply logotherapy well and was somewhat overwhelmed by the sheer volume of textbook information. Hearing Dr. Lucas's case examples and reading about her brilliant skill in conceptualizing treatment plans left me honestly wondering whether I would ever achieve nearly any similar results. When I mentioned my anxiety regarding my clinical success, her advice was not to pay so much attention to myself, but to what the person in my care needed. She advised me to forget about myself in that moment, not to be aware of myself as a therapist, but to, in that moment, focus on their words rather than my inner thoughts and doubts. What matters most is not me, the messenger, but the message of logotherapy, she assured me. So this is what I can share that is truly useful to them, and that is what matters. Her advice mirrors what we find in Frankl's books regarding the pursuit of success and happiness. Dr. Frankl says, do not aim at success, because the more you aim at it and make it a target, the more you are going to miss it. Dr. Lucas used this metaphor. It's like the more you are trying to hold on to a snowball, the faster it's going to melt in the palm of your hand. And Dr. Frankl continues, I want you to listen to what your conscience commands you to do, and to go on to carry it out to the best of your knowledge. Then you will live to see that in the long run, I say, and he repeated that, in the long run, I say, success will follow precisely because you have forgotten to think about it. Encounters are crucial in therapy. The atmosphere that we build is often more important than the words themselves that we speak. It is the context within which our conversation takes place. It is an attitude projected right from the start, one that is realistic, optimistic, and optimizing as we put our training at the service of our clients. In logotherapy, this stems from a holistic view of the person, a belief in our shared humanity, and the recognition of the will to meaning and the freedom of will despite its limitations, because we are human beings. So it's the limited freedom, the potential freedom of a human being. In his very first book, The Doctor and the Soul, Dr. Frankl remarked, the more a doctor is dedicated to his duty, the more he can be of use to patients. So let's just repeat this again. The more a doctor is dedicated to his duty, the more he can be of use to patients. Frankl emphasized that the relationship is not between a repairman and a machine, but between two human beings. He warned that doctors who are purely technical are technicians of the soul at best. That is, doctors who treat the body and the mind as if they were simply fixing a broken machine, while the humanity of the patient is lost or out of sight in the process. And this leads to iatrogenic damage. What is iatrogenic damage? It is a physician-induced misconception when reductionistic ideas are imposed on vulnerable individuals. It may be inadvertently, as iatrogenic damage happens inadvertently, but reductionistic approaches strip people from their freedom of will and suppose an I-it relationship rather than a true, respectful, and dignified encounter between people. True usefulness, said Frankl, comes from the commitment to see the patient as a unique individual. In Frankl's view, the more dedicated the doctor is to this human connection, the more they can help the patient overcome the existential vacuum that often accompanies illness. A true doctor must move beyond deterministic and nihilistic ideas to provide a service to life. Therefore, it is vital for practitioners to be well-versed, to be knowledgeable, and to be experienced. One must be both a good scientist and a good artist to be a good clinician. One needs to know the pitfalls of collectivistic, provisory, fatalistic, and fanatic attitudes, which may be prevalent even in certain therapeutic circles and even in our time, in order to circumvent them and to open possibilities for working together in the search for meaning. In this situation, both therapist and the patient are persons. They are seekers. They turn their gaze toward truth, beauty, and goodness, and the freedom of the person, as little as that may be, to grasp a piece of joy, a piece of care, a piece of consolation, a piece of heaven. We are reminded of Dr. Frankl and his comrades who observed a stunning sunset. After 10 minutes of moving silence, one of the prisoners remarked, "How beautiful the world could be." There are limit situations, such as in the concentration camps, where Frankl noted, We were not even allowed to let each other know our feelings, but we did not need to. In such moments where every word would be too much, no words were necessary. And so we could say where every word, in these limit situations, where every word would be too much, sometimes no words are necessary. The art of the science is to bear witness and to be present for our patients, upholding their dignity and unconditional value, regardless of their life circumstances. This life-affirming attitude permeates the logotherapeutic encounter. Of course, we aim to improve the circumstances, but in limit situations, or even if the circumstances are impossible to lift, because we are encountering barriers, even then, to be ready to affirm the value and dignity, regardless of the circumstances, of each and every person. Likewise, the relationship between therapists, whether senior or junior, is not merely bound by a contract. It is undertaken with responsibility within an encounter with the other. Consider this example. A woman phoned Dr. Frankel in the middle of the night, contemplating suicide. Dr. Frankel spent the next hour talking with her about why she should not do it, finally convincing her to see him the following morning. The woman kept the appointment and told Dr. Frankel that none of his specific arguments had actually convinced her. What did convince her, however, the real reason why she decided not to kill herself, was that Dr. Frankel, this renowned professor, internationally known, professor, psychiatrist, and survivor of the Holocaust, has taken his time and has stayed on the phone with her in the middle of the night. If such care could exist, she felt it might be worthwhile to give her life another chance. To elaborate on this concept of the encounter, in logotherapy and existential analysis, we believe in authenticity, in care, and active listening. We listen for traces of meaning potentials in the words of the other. We see a person, we hear their tone, notice their unique characteristics. We learn of their challenges and ascertain the predisposing, precipitating, perpetuating, protective factors in their lives. We learn about this in our training. We learn about how to identify these factors, how to use these factors, how to watch out for some of the warning signs, how to utilize some of the protective factors, such as the belief in meaning, finding meaning in life, the possibility of meaning awaiting each and every person. And we look for areas of faith and areas of freedom. Within that freedom, we look for values that can be actualized, logo hooks that anchor our patients in a sense of meaning and purpose. Our goal is to reinforce the patient's humanity and their sense of worth. To do this, a logotherapist needs to really internalize logotherapy. That means they not must just learn it, they must learn it by heart. We need to make it our own. We need to live it. Because when we live logotherapy, we truly understand it, and we become aware of our own shortcomings and the need for lifelong learning. We need this humility in front of the mysteries of life, to be guardians of human dignity. As you may recall, in an interview with Adolf Oppel in 1983, Dr. Frankel reflected on the evolution of his career aspirations as follows. First, I wanted to be a doctor. I became a doctor. Then I wanted to become a good doctor. I hope I was not a bad doctor. And finally, I wanted to, despite all this, to remain a decent human being. I still try. Supervision and consultation in the logotherapy framework are professional models through which wisdom is imparted to a different tune. Not to play one's own melody until it becomes repetitious, until it becomes deafening, until it becomes overwhelming, but to hold a space that encourages the melody of the other to slowly emerge, and through evoking it and amplifying it, enable them to take their place, their rightful place in the orchestra. While we often think of these two methods, supervision and consultation, in terms of their functions, a closer look reveals this. Logotheory is one wing, and logotherapy is the other wing of the same bird. Both supervision and consultation rest at the intersection of theory and practice, and these two wings need to work together and in harmony in order to be conducive to flight. Following the Hiroshima bombing, a young girl, Sadako Sasaki, developed leukemia. While in her hospital bed, she started to fold origami paper cranes, orizuru in Japanese. The symbol begins with the ancient Japanese legend, according to which the crane is a holy creature that lives for 1,000 years. Anyone who folds 1,000 paper cranes will be granted a wish, most commonly a recovery from illness. According to Japanese tradition, the birds are not just paper, they are tangible countdowns to survival. Sadly, Sadako died before she managed to fold enough paper cranes, but her story survived and was handed down to us. Today, paper cranes are a universal symbol of the human spirit. And speaking of birds, speaking of cranes, which are those wonderful birds all over Europe in the spring, the signs of hope. Speaking of birds, I would like to invite you to close your eyes for a moment and ponder the ways in which logotherapy, when truly lived, can enable even an imaginary bird to soar. Thank you very much for your attention.